Imagine waking up one day feeling fine, only to suffer a devastating heart attack or stroke shortly after battling a seemingly routine viral infection like the flu. Shocking, right? But this isn't just a scare tactic. New research reveals that viral infections can dramatically spike your risk of these life-threatening events, sometimes tripling it in ways that might surprise you. Buckle up as we dive into the details, and remember, your health could depend on what you learn next. Fresh findings from a deep dive into 155 scientific studies, published in the Journal of the American Heart Association, show that the danger doesn't fade away right after the fever breaks. In fact, your chances of a heart attack or stroke soar in the weeks and even months following certain viral bouts. For instance, after catching the flu, you're about 4 times more likely to experience a heart attack in the ensuing month, and a staggering 5 times more prone to a stroke. With COVID-19, that heightened risk triples for heart attacks or strokes over the next 14 weeks, lingering at elevated levels for up to a year. It's like the virus leaves a ticking time bomb in your cardiovascular system, and this is the part most people miss, because we often think of these illnesses as passing annoyances, not long shadow threats. But here's where it gets controversial. Chronic viral infections aren't just temporary blips, they can elevate your heart risks for years on end. Think about conditions like shingles, caused by the herpes zoster virus, HIV, or hepatitis C. These aren't your typical colds, they stick around, and the research highlights how they amplify your vulnerability to cardiovascular woes. For example, individuals with HIV face a 60% increased risk of heart attack and a 45% higher chance of stroke, while hepatitis C bumps up heart attack odds by 27% and stroke risks by 23%. Shingles, often dismissed as a painful rash, raises heart attack chances by 12% and stroke by 18%, with that extra danger potentially persisting for up to a decade post-infection. Experts like study lead author Kosut Kawai, an adjunct associate professor at UCLA's David Geffen School of Medicine, emphasize that while past studies hinted at links, this comprehensive analysis directly compares viruses, revealing how profoundly they can disrupt heart health. Previous research has shown that viruses may elevate heart risks, but we took a comprehensive look at many studies to compare how much different viruses affect the chances of having a cardiac event, Kawai explains. It's a wake-up call for anyone who's ever shrugged off a viral illness as just the flu. And don't get me started on the public's awareness, or lack thereof. As Robert H. Hopkins, MD, medical director of the National Foundation for Infectious Diseases, points out, many view influenza as primarily a lung problem, but it actually invades other systems, including the heart. Influenza also infects tissues in systems beyond the lungs, including the heart, Hopkins says. Influenza also reduces resistance to and can predispose people to bacterial infections, which can cause pneumonia and sepsis. All of these mechanisms can have profound cardiovascular impacts. To put it simply for beginners, viruses don't just attack your respiratory system, they kickstart a chain reaction in your body that can damage your heart. Your immune system fights back by releasing inflammatory molecules and making blood more likely to clot. Think of it as your body's defense turning into an overzealous guard that ends up harming the very organ it's supposed to protect. This inflammation and clotting can linger long after the virus clears, impairing heart function and even contributing to plaque buildup in arteries, those hardened deposits of cholesterol and fats that can rupture and cause blockages. As Kawai notes, it's like a delayed fuse that explains the spike in heart attacks and strokes. Moreover, these viral effects aren't limited to the heart. Studies link them to increased risks of cancer, dementia, and diabetes too. For Olive Ardeni, PharmD, a professor at the University of Minnesota, the long-term impacts of chronic viruses stood out. I was surprised by the amount of research available for viruses that aren't as well recognized for their associations with heart disease, such as hepatitis C virus and herpes zoster, she shares. Her take underscores a controversial angle: we underestimating common viruses as silent heart saboteurs. The study calls for more investigation into others like RSV and HPV, which might harbor similar hidden dangers. But fear not, there are proactive steps to safeguard your heart, especially as we head into the chilly holiday season when viral spreads and cardiac emergencies peak. Preventive measures, like vaccines, hygiene, and lifestyle tweaks, could be your best defense against this viral heart connection. People should recognize that vaccines are the best means of protection from an overwhelming systemic response that may lead to multiple organ dysfunction, advises Amit Mahajan, MD, a spokesperson for the American Lung Association and medical director at Innova Health System. Heart disease remains America's top killer, with Christmas Day seeing the most cardiac deaths annually, followed by the days after. Stress from festivities, combined with viruses that ramp up stress hormones, can overload the heart, particularly for seniors or those with existing conditions. And let's not forget holiday indulgences, heavy meals, more alcohol, and cold weather all add strain by constricting blood vessels. So, protect yourself with good habits, wash hands diligently, consider masking in public if you're at risk, and prioritize vaccinations. This study demonstrates that there are many viruses that can cause cardiovascular injury, and other viruses need more study to determine if they have similar impact, Hopkins concludes. Protecting yourself by vaccination or other good health habits could result in lower risk for cardiovascular disease. This is just one more reason to get vaccinated for your own better health. Now, here's the controversial twist. Some might argue that viruses are just one piece of the puzzle, overshadowed by lifestyle factors like diet and exercise. Is the heart viral link overblown, or are we ignoring a major threat? What do you think? Does this change how you'll approach flu season or even chronic conditions? Share your thoughts in the comments. Do you agree vaccines are a game changer, or do you believe more research is needed to prove these connections? Let's discuss.